Okay. What about depression? Depression, I'd like to give you some background on before I talk about it and say a lot of doctors divide depression into two flavors. One is I'm depressed because something bad happened. Okay? A family member passed away. I lost my job. I invested all my retirement money in Lehman Brothers stock. Nobody likes the MGB. So you're depressed because there's something bad. Okay? That's called situational depression. And it kind of makes sense because something terrible, you're in Bosnia or something awful is going on. Another kind of depression is called clinical depression or non-situational depression. And the way I think about that is you could be fabulously wealthy, you could be a movie star, everybody could like you, popular, attractive, everything good, and you can still be sad. You know, like the movie stars who get depressed and stuff like that. And so I think of as an example is Marilyn Monroe. You know, I don't know, whether she's murdered by the Kennedys or, who knows. But if you say that she killed herself, here is a very attractive person on top of the world, could, probably have anything she wanted, and she took an overdose of drugs. That's clinical depression because she had everything and she's bumping herself off, if that's the story. And so if you have two kinds of depression, I'd like now to think of my patient. My average person of all the 5,000 people is a 39-year-old woman who weighs about 300 pounds and has diabetes and high blood pressure. Now that person has a probable survival we can predict of about age 65. That's if you put in these insurance company numbers. And if I operate on her, her blood pressure will go away, her diabetes will go away, she'll probably be 150 pounds by the next year because the average weight loss. And her survival should go up, according to the charts, to around 85. In other words, she gets roughly 20 years of additional life. Okay? Now, if she has situational depression, I'm depressed because I'm overweight and I'm diabetic and I have to take the medicines and things like that, we might make her depression better. If, on the other hand, she has clinical depression, we could also give her $1 million and she still could be sad because that's a chemical in the brain, serotonin or something like that. So in our patients where we're going to stop your diabetic medicines and stop your blood pressure medicines and things like that, we do not recommend stopping the antidepressants. We recommend you wait 6 to 12 months and meet with your doctor again because there is a possibility that will fix that depression if there is a component of situational depression. But we don't think you should stop things like Paxil and things like that right after the surgery.